Welcome back once again, everybody. I'm super excited to be here with Denise. She is actually a patient at Richmond Integrative Functional Medicine, and she's going to be sharing her story with us today. Um, Part of this is just for you to hear from other individuals who've gone through struggle, gone through a lot of stuff. Her story is actually really, really amazing, and to hear like how she's conquered different things, and ultimately how functional medicine has changed her life. And so, if this information is helpful, please like, share, subscribe. Also, if you have any topics you'd like us to talk about, please share those because, as you know, ultimately this is to help people to educate, encourage, and empower. And so this is here for you. So with that, Denise, welcome. I'm so glad you took out of your time to share with us today about your story.
My Pandora's box, as I call it.
Yep.
Put it in a box, keep the lid shut tight.
Well, and we talked briefly before we started the conversation about how this is a little scary
Yes.
because you're sharing, things that your family. Some of these things actually maybe your family doesn't know. Who knows? So,
Yeah.
but why don't you start back? Maybe you could go back and start like when the first time you were ill.
Okay.
Start with that because it's pretty amazing. You've been through cancer twice,
Mm-hmm.
and you started at a very young age,
I
and
did.
so that I think back when you had it, it was rare. Now it's becoming more common. So why don't you kind of talk about that a little bit briefly and kind of walk us through how you first interacted with the healthcare system?
So I was 20, um, and I had a lot of chest pains, and um, I was reading a book by Gilda Radner. I think it was called "It's Always Something," and she was going through cancer at the time, and she wrote about all the alternative medicines that she was using instead of regular medicine and all the terrible things that happened to her. And I remember reading the book, closing it as I finished it, and telling my parents if I ever got cancer, I would never, ever do any sort of treatment. That was it. That was the end. I was over and done with. About 2 months later, I was calling home from Virginia Tech to tell my parents I had a tumor in my chest the size of a grapefruit. As Jeff tells the story, my husband, he would say that it was the first time my dad ever told him that he could sleep in the same bed with me in college, not being married, just to make sure that I would stay alive so that they could come pick me up. So I went to NCB. They took ribs out. They found out that the cancer was non-Hodgkin's lymphoma, stage 1A, which was a true blessing. Come to find out, it runs in my family. And my aunt had the exact same type that I did, but found later, and she didn't make it. So went through chemo. My parents didn't want to tell me at first that I had cancer because I had made this specific statement that I was not going to have chemo. As soon as I woke up and they said, "You have cancer," I immediately said, when is the first chemo treatment? So changed my mind on that one. Went through 8 cycles of what was called promocytobon at the time. Hopefully I'm saying that. Pick a medicine, they threw it at you at that time. And then I did 16 cycles, I think, of chemotherapy to the chest. So that's what I live with now, is the radiation piece of it.
Gotcha. And so, what were some of the things you had a very firm statement? I'm never going to do chemo. I'm not going to treat it. And obviously, 20, you didn't expect to get diagnosed roughly 2 months later. Like, what were some of your interactions with the healthcare system? Because you were young back then. Back then, it wasn't quite as common for younger people to, get cancer. Was it traumatic? Was it the system great? Like, tell us about that interactions. I think a lot of people skip over like how people with significant health issues when they interact with the healthcare system, how that by itself can be either a blessing or it can be itself a barrier or a trauma or whatnot.
So I was very blessed. I honestly think way back when I had cancer, it's so much better than what it is nowadays, because my son at 18 ended up with cancer and going through what he had to go through at the exact same place that I went through it years before. It was a way worse going through it with Josh. And for me, it was fine. in terms of I had a great doctor. They talked to me. They dealt with me. There weren't services around it, but there also wasn't the what I was seeking at that time was like, what should I be eating? Are there vitamins I could take? So more the functional medicine. There was no talk about functional medicine. There's a huge funny story in my family where my dad, who's the researcher of everything, discovered that vitamin C could cure cancer. So he was determined to show us that vitamin C would work, and he wanted me to take mega doses of vitamin C. So we made him take the mega doses of vitamin C. Well, you know what happens when you take mega doses of vitamin C. So
Yeah.
we didn't see him for a day or two after he did that. But we were trying to find different ways. He had researched about shark cartilage, taking shark cartilage pills. So we were trying to look at both, and there wasn't much information for functional medicine there at all, along with like trying to find a wig, just, simple stuff of trying to fix things.
Now, after you got your treatment for the non-Hodgkin's lymphoma, what were some of the side effects from your treatment? Were there any neuropathy issues, scar pain issues? What kind of, the first 3 to 6 months, what kind of things were you struggling with after the first treatment?
So I had the leg cramps, really, really bad leg cramps. I have neuropathy. I still have it a little bit in my fingers. Of course, the scars that I've had, and I get all off kilter is what my physical therapist will say, because I'm missing some ribs. My body will readjust itself at times, and so she'll have to put me back in place, as she calls it. So
She adjusts you.
yes, that's exactly. In fact, I just did one of our first cupping. I tried cupping the other day, and that was the best thing because I have scars on my back from the second chemo, which I struggle with probably the most out of all the scars. And so tried cupping, and that was phenomenal. I never knew it existed till the other day.
Now, one thing as well that I think you had the cancer when you were 20, but you also had some issues with like syncope, passing out, some other kind of things before that, correct?
So I had POTS, yeah. And at that time, nobody knew what POTS was. So I now say
The original.
original POTS, where I'd go in and I would get saline, and they would tell my mom that it was because I just wanted attention, and that really wasn't helping me. And that I had so many people tell me that Florinif was a placebo drug. It wasn't real. It wasn't helpful. But luckily, I had a wonderful doctor at that time, and he was like, the side effects of this, it makes you retain water, and you need to retain water. So he put me on it and saved my life on that piece of it.
Yeah. And your physician back then, we both know the person, we try not to name names here, but very old school physician who would just look at people for the symptoms and be like, I think this is going on. And, we don't really do that anymore. We kind of put people in these boxes. And so you would have gone untreated for your POTS for decades, potentially.
Yeah.
If he hadn't just done good old fashioned, hey, you've got volume issues. Let's give you a thing that makes you hold on to volume.
Yeah.
And it's funny how you were gaslit a little bit back then. Like, oh, it's in your head. Don't worry about it. Florinef is a placebo. That's.
Yeah. Many, many doctors going through that process of, you need a psychologist. It's just attention, or it's just stress. That was the other big thing. Oh, you're just stressed.
So let's talk about that briefly. What kind of symptoms were you having that they were saying were just stress?
I'd get chest pains, really, really bad chest pains when my blood pressure lowers. And so they would constantly say that piece was stress. Then if we went forward after the first cancer and the radiation and everything, I also then had racing heart. So my heart would race all the time. So then, of course, they wanted to put me on antidepressants because they were telling me I was having panic attacks. And finally, the doctor we know and love said to me, "It's odd that you only have panic attacks when you stand up. You never have them when you're sitting down." And so he did a couple tests and he was just like, "No, it's part of your POTS.
Yeah.
We have to manage it." And so he managed that for me.
Did it actually get worse after the chemo?
Yes.
Yeah. Because there's different kinds of dysautonomia, and one of those is actually related to demyelination in diabetics, where they can get like a type of POTS in elderly age, but you can actually sometimes see that in chemotherapy patients where they demyelinate.
Oh, wow.
And so, yeah, it kind of makes sense that made yours a little worse. And so you went through things, you got treated, you had some other issues before, and then life went back to normal, and you kind of went about your life. Why don't you tell us about your next big kind of interaction, I guess, with the healthcare system?
So I was coming, it was actually right after 9/11. I was driving home and we found a lump on my back. And so I just went, not knowing I should have gone to my oncologist, wish I had. Went to a plastic surgeon who just said, "Oh, it's an ingrown hair. We'll take it out." And I kept saying, "Well, I've had radiation to the front. Is there anything that could happen in the back?" "No, nope, ingrown hair. We'll just take this out." And she was like, "In fact, I wouldn't even test it, but they make me. The insurance makes me." Well, thank God the insurance made her test it because it came back positive for cancer. So then I had to go back in, have margins taken out, so about that much. And then I had brachytherapy, which is nothing I would wish on anyone. You kind of look like someone from Star Trek. They put radio rods in your back, and you sit in a cement room for a week. No one can visit you, except for
At
our
that point,
friends that break through and ignore the
yeah.
rules.
Well, you need those kind of friends, don't
Yes,
you?
we do.
Um, with because that cancer was a rhabdomyosarcoma, if I remember
Yep.
correctly. Yeah, which actually can be a side effect of radiation.
Mhm.
It's actually, I've had another patient who got, for breast cancer, got rhabdo. It was like 20 years later. I think it's kind of interesting that the first response of the specialist was it's nothing
I
unrelated,
know.
and it actually was related. And you kind of and let's talk about something briefly. You're an empath, which why don't you tell us about that? Because I think that's been a part of your journey a little bit.
Yeah.
Your spidey sense, your intuition, your gut feeling, you know what I'm saying?
Oh, no.
Like,
Yeah. Right.
tell us about that a little bit, because I feel like that's something that people maybe heard the term, and it's something we talk about a lot, about being, people that are hypermobile or empaths, and we'll get to that in a second. But how did your intuition play in all this? Because, you know what I'm saying, as far as
I wish
what path you
I wish I was the person I am now back then, because I would have pushed a lot harder and said no, because I knew there was something wrong. But then the other side of me didn't want to believe that there was something wrong. So I didn't say enough, in my opinion. But there's been plenty of times I've called you before and I'm like, "I know it won't show up on a test yet, but I know that this is going on. I don't feel right. And so now I speak up a lot more about things. But it's a gift when you can tell things about yourself, but sometimes it can also make you look odd to people. If the doctor doesn't know you well enough and doesn't understand that piece, and you walk in and you're like, "I know I have strep throat." I'm like, "Well, I've done all the tests and everything, but you don't have strep throat." And I'm like, "I know, but if I come in 2 more days, I'm gonna pop positive for strep throat." I just know. Um, and
and you
99% of the time, that's what
yeah,
happens.
yeah. And I want to briefly talk about intuition. I'm actually reading a couple of books, right? I'm reading a bunch of Jonathan Haidt's work right now, which I'm not sure if you're familiar with his.
Mhm.
He wrote his most recent book is The Anxious Generation, but he writes about a lot about how our minds think. And he talks about, the your intuition, or you'd call it your gut feeling, and your consciousness. And
Mhm.
it's really interesting how some of the newer research is showing that our intuition, that gut feeling, is like the elephant. and our brain, our consciousness drives the elephant, but a lot of times we get these gut feelings that are way, way bigger than our ability to comprehend. And sometimes the reality is our intuition is more keen than our thinking mind is. But then you have to spend the time to actually explain, I feel this way. And then your conscious mind starts diving into and researching. And then, and after a while you figure out, oh yeah, when I have these symptoms, 2 days later, it's strep is positive.
Mm-hmm.
When I meet these individuals, they tend not, so let's talk about that a little bit. But I use the word being an empath because a lot of my patients who are hypermobile are empaths. And it actually gives them this spidey sense, this intuition, but that also is a part of the dysautonomy in POTS as well. So could you talk, because that's a journey for you learning about that for yourself. I mean, you've had this gut feeling, but now you've kind of filled in the gaps with, working together with me with what that actually means to be more insightful with your health. So can you talk about that interplay a little bit?
Not quite sure where I want to go with this, to be honest with you.
Take it wherever you want to go with it. And again, if you feel uncomfortable taking it too far anywhere, then
Now,
that's your purview.
so to me, it's a gift, but it can also, you have to be for me, I have to be protective also. And I haven't learned that piece of it. So I can be in a room with people that are very high energy, and it will suck the life out of me. So I have to be really, really careful about that. And a lot of my members in my family can be very high energy. So I'm slowly learning to, but it helps too it also helps in that you can sometimes, if you pay attention, and it's gotten harder now for me now that we do Teams calls a lot, but it worked. It would help a lot. If I was in a room, I could tell who wasn't for something and who was for something just by being in the room and just feeling how people feel. And I used to be much better at that piece of it than using it to help me. I think now that Teams meetings have come on, it's more, and I'm more by myself, that I'm trying to use it, especially as I get older, to help me.
Yeah. And the way I explain being empath, and you've heard this many times before, it's kind of like that spidey sense. When people are neurodivergent, there's we think about Asperger's, think about ADHD, dyslexia, but there's also this intuition, this emotional intelligence that you can kind of go in a room, you feel the energy. The kind of way I think about it is it's helpful if you're a lawyer, because if you're
Yeah.
interviewing someone on the stand, you can tell they're being dishonest with you. You can be like, they're holding something back. I'm gonna keep on going. If you're a salesperson, you can be like, you can know this person's not buying. This person, they're thinking about it, and you can kind of know where to focus on. And it kind of gives you this little. It's really super helpful for caretakers, for women, because you kind of it's like your security. You can kind of know this place is safe, unsafe. It's like that intuition. One of my friends, I've actually interviewed her, Rosanna Campana Hodge. She's a child psychologist, and she specializes with trauma, and she kind of refers to it as being clairvoyant. She can actually walk in a room with a new patient and kind of get a sense for what kind of trauma they've had, where they've come, just from because she's honed it in so much.
Mm-hmm.
And a lot of people don't get that, and they think it's all in their head. They're hypochondriac. They're just anxious. They're just, they're worry wart. Like why? And because it doesn't quite make sense, because it's dealing with the subconscious aspect of your nervous system.
Mm-hmm.
But if you train it, and I've had patients who train it, they can actually like for you, I know I'm sick. I know I'm not sick. I know. And even with family members, there's something off here, and we've talked about before how it's actually been helpful with your work, with kind of knowing there's some funny stuff going on here.
Mm-hmm.
I need to look into this a little bit, and people are like, how'd you know that? And you're like, I just knew,
Yeah.
But the other thing, I want to talk about this a little bit, because it also means if you have trauma, it can be more impactful with its impact on your nervous system. And obviously, going through your health journey, you've had some trauma with interactions with the healthcare system and other stuff. Why don't you talk about how that interaction, and how your nervous system, your intuition, how it's all played together for you?
So I don't know if it's helped me as much as it helps me when dealing with medical system, like when my son went through everything that he went through. Um, I have a little plaque that I had in my purse all the time that just said, "Trust your gut, not the doctor." And there were so many times that I had to you have to advocate for yourself and you have to advocate for your family. And there were plenty of times when I'm sure they thought I was a crazy woman, but I knew that it wasn't the right thing for him, or this wasn't what we wanted to do. Um, they're much older now, but I still do it.
Well, it's kind of funny because your previous doctor, who was a mentor of mine for a while before he retired, he used to. I remember one of the things he used to say was, when you're taking care of a patient in the hospital, one of your goals is to keep the hospital and the specialist from killing your patients. I remember hearing that as a young physician, going, "Man, this guy's he's kind of out there. He's kind of crotchety. Like, why would he say that?" And then fast forward, and I'm talking about, it's now the literature is that medical error is the third most common cause of death in our country.
Mhm.
And it's like this guy saw this 30 years ago and knew it. And people kind of looked at him kind of weird, but he fought for his patients. And you had that
Mhm.
experience. And now realizing actually, yeah, you need to, when you're engaging acute critical care, you need to be really have your spidey sense your ears up because everybody's trying their best, but if medical error is the third most common cause of death in our country, then you need to kind of question things and feel good about stuff and know whatever's happening is the right thing. Um, so let's fast forward a little bit. Where's functional? So you say we met, well, years and years ago before we started before I started doing functional medicine. Why don't you talk about that journey? Because so far we talked about your interaction with the healthcare system and how conventional medicine saved your life, but also you got to a point in time where you had health issues. So what's going on with your health before we first met as far as stuff?
Um, I had a terrible gut. And I honestly think, me personally, if my stomach's okay, then my POTS is much better. And so it wasn't equaling each other at the moment, and so I was having problems with that. Um, and and y- you're like the old doctor, where you investigate things instead of just kind of saying, "Oh, you need to see this specialist," or "Oh, go see this specialist." I prefer you either have one that's an investigative doctor, or you have an ER kind of slots you to different areas that you need to go kind of doctor. You're the investigative. Um, so I I needed to get my stomach fixed in order for my POTS to be somewhat livable. And um, it wasn't working with, I was on Prevacid. It wasn't working. I was on all these other kinds of, medicines off the sides, and that wasn't working. And so I came, actually, we met because of my daughter, because she had POTS and no one could get her POTS straight, even after all the years of me going through it. Went through the elimination diet with her. Probably wouldn't have done it for myself, but I did it with her. I will say I'd left you and gone to Wegmans with the list of all the food I needed to buy. I picked up the phone in tears, called Amanda and said, "You need to get here. I have a full shopping cart and I need another shopping cart and I don't know what I'm doing. And I'm having a mental breakdown in the middle of the grocery store." So she showed up. We had fun. We did it together. We nearly killed the rest of our family while we were doing it. I think she ate a whole banana tree in the process of all of it because of the sugar, needed to get the sugar in. Um, but it made me realize that it gave us knowledge. Like, she now knows if she eats oats, she's not going to feel well. So she's modified her diet so that she feels better and she's up and running. And so once they were both out of the house, I thought, I really need to get myself straight so that I can hang out with my new grandbaby coming up soon. So,
That's awesome. Yeah.
um, and it's been such a huge difference. I feel so much better. Um, the only part I don't like out of all of it is I take a lot of pills. But you know
Yeah.
what? They're all
Well,
vitamins and I don't.
a lot of supplements. Yeah. Well, it's one of the things that's really interesting, there's a whole nutritional side of cancer. If you have certain nutrient deficiencies, you're more prone to different cancers. If your vitamin D levels are low, you're more likely to get cancer. If you have some of your trace minerals are low. And it's interesting if you're hypermobile individuals need more protein, particularly collagen. They
Mhm.
need more trace minerals. They all on testing because of how inflammation impacts their immune systems. They all tend to be vitamin C deficient, B vitamin deficient, um, vitamin D deficient. It's interesting also as well. A lot of them have gut issues or SIBO problems, which you've dealt with in the past, and,
Mhm.
and those individuals tend to get multiple B vitamin deficiencies, which can make peripheral neuropathy worse and make your neurological stuff worse. So all of a sudden, you know, I said a lot of words that's kind of complicated, but it's a basic, lab-based, clinical-based nutritional dietary thing, particularly with dysautonomic patients that are hypermobile, can have that single thing by itself can have a huge impact on the symptoms, which are many, And I want to talk about that a little bit about your discovery process because a lot of things I've said right now, some people, what if you're hypermobile, you need these nutrients and you're more prone to SIBO and gut issues. And I had no idea. Oh, I have those problems. I had no idea they're connected. Could you talk about that a little bit? How that's changed your current health status? Because when you have dysautonomia, there's a direct correlation with your guts, nervous system, and your central nervous system.
Um, yeah. So, for one thing, I can now get out of bed and I don't crack and crackle all the time because the I forget what it's called. You'll probably remember it. SPX, SPM.
SPMs.
Yes. Love that
Okay.
thing. Miracle. It's an absolute miracle. For all people, everybody should be taking it. um, but so that's helped. The what I take GI microbe, I think, for my stomach, and that I've gotten completely off of Prevacid or any of those kinds, especially after reading all the terrible things that can happen with those. Um, it's like I've been able to get off of most of my prescription meds except for two, and the rest of them have all been vitamins and minerals that I'm on now, which is
So
helpful.
which medications were you on? This is huge. I think this is a big deal. Which medications were you on previously that you were able to get off of? You mentioned the Prevacid, which is a PPI.
Mm-hmm.
Other medications were you on previously that you were able to get off of?
Now I have to remember.
I know. Sorry.
Oh, man.
To go back in the
I
past,
know. I have to
deep
go back.
recesses.
I can tell you the two that I'm on now because I'm never letting them go. They're like what they've been on. I've been on. I can't. Oh man, I have them all in a jar that I need to throw them all away. But I've never made it to one of those medical things. Both Amanda and I have a case of ones we need to go and
You throw away.
throw them away. A lot of them didn't work. There was one that I took that it was supposed to increase my blood pressure when it went low. I think it's
Was that Midodrine?
yeah, that
Midodrine.
which had
Okay.
terrible side effects for me.
Are you still on the fludrocortisone?
Yeah, that one I'm
Still
on,
on a little bit of
and the
that? Okay.
Pindalol.
Gotcha. But you're able to get off of. Let's talk about the PPI briefly because I think more people are realizing that these acid blockers can actually make things worse. They
Mm-hmm.
can actually drive yeast and strep overgrowth in your gut, which can drive a lot of gut issues. They can drive nutrient deficiencies, B vitamin deficiencies, iron absorption issues, and they can also they're associated with increased risk for peripheral neuropathy,
Mm-hmm.
as well as cardiovascular and kidney issues, and even dementia.
Yeah.
And so talk about getting off that drug because just getting off that one drug by itself, it's one of those things. You got gut issues, so hey, let's give you an antacid, and it
I
treats one gut problem and causes five other ones.
yeah.
Years later, but people don't realize. Maybe just talk about that one journey with that medication. What some of the things you later realized it was causing, and like the whole process of getting off of it.
Well, I found the funny thing I found was even though I was taking it, I would still get terrible heartburn at times. So so then they were like, "Oh, just increase it." And I was like, "To what point am I increasing this? That it's not a good thing. Um, Getting off of it, the one thing that I did have to do is I did have to go slow because it almost caused like a huge storm in my system as I got off of it. I tried going cold turkey and it didn't work. So I slowly got off of it, but I added the olive oil, is it oil extract pills?
Olive leaf extract, yeah.
Yeah, added those and the GI microbe. And I think one other for a while. You had me on a couple different things
Yep.
before, and I was able to get off of it, which it I don't want to go into major detail, but it corrected my system a whole lot better, and I it makes me feel a lot better.
Yeah.
It I don't feel like I'm on something that's gonna cause me Alzheimer's or anything like that in my later
Which is a
years.
concern.
Yeah,
Concern.
yeah.
How's your neuropathy doing now? Is it the same, better, worse than it was, 5 years ago?
It's better now, which
Hmm.
I'm not sure why, but
It's not supposed to do that, is it? It's
no, it's
supposed
not.
to get worse as you get older, not
I
better.
mean,
Huh, that's strange. Well, no, I'm say it jokingly because there's interesting herb nutrient protocols like alpha-lipoic acid, N-acetylcysteine, glutamine that can help with nerve integrity, but also some of the things in the functional medicine, some of the post-cancer kind of things to minimize the side effects of some of the chemotherapy things. I've had now the later out you someone has neuropathy. I had one patient who he came to me within 6 months of getting head and neck radiation, and he had horrible neuropathy.
mm,
He had also chemo, but 6 months later, he forgot he had it because we got him pretty soon. If
mhm,
you get someone 20 years out, you're not gonna have the same impact, but you started these things soon enough that, it's still there, but it's better than it was,
mhm,
which is also gonna impact your POTS and dysautonomia,
mhm,
you know?
yeah,
So, it's kinda all connected.
yeah.
Um, so, um, what What would you say your biggest your takeaway if someone's listening to your story, like, wow, she went through a lot and she fixed her gut and stopped and took a few things and she's, doing great now. She's going to see her grandbaby when her first cancer was like, how many decades ago, right? You know, like what words of encouragement, what insights, how about this? Maybe do 3 insights and three encouragements. Like what did you say the top 3 insights that you learned through this whole process that you're like, this is gold. If I could recommend 3 things to everybody with a health issue, regardless of what it is, these are 3 things I learned that I would recommend everybody do. Um,
1, trust your gut. 2, if you don't have a doctor that's answering your questions and listening to you, even if I don't know how many times I've come to you and said, "Well, this medicine or this supplement makes me feel like this," and you're like, "Well, that's not something that normally happens, but with you, it could. Okay, well, let's try something different." Um, and when I back a while ago, and I'm going to do this without crying. Um, I had asked a doctor to keep me alive long enough to get my kids out of college. That was my goal because he told me I wasn't a marathon runner. And so I said, I just want to stay alive enough to get them out of college. And he was like, well, you really want to stay alive until you see your grandbabies because that's the whipped cream on top of it all. And so after he said that, and I loved him to death, that's when I started investigating other things because I did want to see my grandbabies and I wanted to be healthy enough to take care of them. And so if my takeaway is if regular medicine isn't making the whole package, then functional medicine should be added in.
yeah. And if you could have 3 words of encouragement to people out there who are struggling, what would you say? They've heard about what you've been through and where you're at. I mean, it's kind of cool. Like that, the exact same thing happened to my father-in-law with his liver transplant. He was like, I just want to survive to see my kids graduate from high school and then see them go through college. And oh my gosh, I might see them get married. And then now he's seen all of his grandkids. And
Yeah.
so he's in his mid 70s still kicking it. It's It's priceless, right? What words of encouragement would you have?
Never lose hope. I mean, I think hope helps everything and if you're someplace where you're not getting hope, then change. Just get hope. Um, Encouragement. Have a good friend system because that always helps. And I think that if you listen to your gut and you keep the hope, then pray. I'm a big
Prayer is important as well. Yeah.
I'm a big believer in prayer. So somebody's listening.
Yes, they are. That's awesome. Yeah. Um, so thank you so much for your time. Thank you so much for sharing. I know that we talked about this before, and this was you had some angst about it because you're like, "Bro, this is going to be out there in the ether, and once you put it out there,
No,
it's like social media. It goes out there, try not to spend too many, So I do thank you for your time. I mean, the goal of this was just for, this is people think functional medicine is just for high level people with or it's it's for everybody, and
Mhm.
it's when you share your story of encouragement, which I think is awesome. On the hope, I wanted to add one thing on the hope thing you said there. I had two patients that came to me with different cancers. One came with mesothelioma, and one came with renal cell cancer, and there is within the same time frame. And typically with mesothelioma, you live for like a couple of years late afterwards. I mean, it's a slow kind of cancer, and typically with renal cell, usually within like a year, it's kind of because his was already spread. It was interesting. The one person with the mesothelioma, it destroyed his wife. You could tell he was crushed. You could see in his eyes, and he was dead within 3 months. He should have been alive for at least another year. And then the gentleman with the renal cell, he lived almost 5 years, and he was like, "Dr. Hartman, I've lived a good life. I know where I'm going when I die. I'm good to go." And I'm like, "Okay." And he just kept the home going. And it's really interesting how the perspective and how they took the news. For two cancers that were, pretty bad off, but
Yeah.
one should and it's just interesting how much hope, having a reason for living,
Mhm.
have a reason for what is your reason? What's your why? Having a reason why you
Yeah.
do what you do, just that alone, can have a massive impact on your outcome with your health. And I think that, if nothing else, I mean, you're getting, you said when you're having, when's your grandchild due? You said
July.
July. So we're
July.
talking about a month.
I know.
The
I'm gonna be a
ice,
grandma.
the whipped cream's coming.
That's right. Gonna have the new goal.
Well, yes. So the question, maybe next time I see you, I'll have to ask you, what's your next goal?
Yep.
I mean, that's my thing for you. What's the next goal? What's your next goal after you get the whipped cream? You can
Yeah.
share what's your share rate, right?
Yep.
So
Exactly. Just keep at.
absolutely
Yep.
cool. Well, thank you so much for sharing your time. Thank you so much for your insight. For all those out there, hopefully it's helpful for you. And otherwise, take care. We'll talk to everybody soon.